Hello po muli. So, balik po tayo sa interesting topic, palpation. Temples in the children. So, hand and feet. So, palpation of temples in children. So, sa may sentido, ano? In babies younger than 6 months, palpation on temples is used for diagnosis. The area to palpate is that between the end of the eyebrow and the temple hairline. So, ayan po. Kita natin. Dali parang sa ano nang may sentido. So, ganyan po natin ipapalpate. Kaya galaw na galaw ang baby. So, this area is palpated by gently resting the index, middle, and ring fingers. So, between the end of the eyebrow and the temporal hairline. So, ingat lang po tayo pag nag-ano tayo dito kasi yung baby, lilikot yan, baka matusok nyo yung mata. Kaya pinapahawakan po yung face. Hawakan nyo dun sa nanay. So, with the ring finger nearest the end of the eyebrow. The right hand should be used to feel the left side of the child temples. Minsan po, problema pag magpalpate tayo sa mga bata kasi ayaw nila magpahawak. Iiyak yan. So, gagawa po tayo ng paraan na siguro nililibang yung bata and ano, para hindi siya masyadong maglilikod, makakonsentrate po kayo. And the left hand should be used to feel the right side. So, yun po yung pwesto ng inyong mga kamay. Kung ang area po ay feels hot under the three fingers, nagsasabi po ito na may invasion of wind. If feels cold under the three fingers, so invasion of wind cold naman po ito. Or accumulation disorder from stagnation in the digestive system. If it feels under the index and middle fingers, yung index po at saka middle lang to ano, pag hot ang inyong naramdaman, nagsasabi po ito na may init and cold below. O, heat above, may init sa taas at malamig sa baba. So, if it is feels hot under the middle, yung inyong pong palasingsingan, middle and the ring fingers. So, nagsasabi po ito na may heat mula sa from fright. So, it feels hot under the index finger only. This indicates accumulation disorder. Napakahalaga po ito kasi yung baby hindi pa nakakapagsalita. So, dapat alam natin yung equivalent meaning ng mga part na to. Kasi hindi mo naman matatanong na, natakot ka ba baby? Makakapagsabi lang nun yung nanay. Yun. Or, natunawan ka ba baby? Siyempre, hindi naman siya makasagot. So, malalaman natin sa pagpalpate. Stagnation of the chest or breastfeeding problem. So, pwede rin pong may problema sa breastfeeding. Pag may index finger heat na naramdaman kayo. Of course, hot feeling in this area also correspond to the objective feeling of heat, cold, flare, which may or not correspond to an actual fever. Finally, the temperature of this area of the baby's forehead should be compared with that of palm. So, pag ginawakan po niyo yung sentido, dapat yung palm din niya ay hawakan din ninyo. So, kung mas mainit po yung kanyang palad kaysa sa sentido, nagsasabi po itong may empty heat. Ibig sabihin yung empty heat, nasa loob na po yan, ano? Pero kung mas mainit po yung sentido or yung temples kaysa sa palad, so nagsasabi na po ito ng full heat. Okay, summary. Temple palpation in babies. Hot under the three fingers. May external invasion of wind heat. Cold under three fingers. External invasion of wind cold. So, lagi nating tandaan. Siyempre, pag cold, kung naramdaman, cold po yung pumapasok. Or may accumulation disorder. Pag hot under index and middle fingers, heat above, sa taas po ano. Pag cold, below. hot under middle and ring fingers, heat from fright, hot under the index finger only, may accumulation disorder, stagnation of chi in the chest, or breastfeeding problem. Temples hotter than palms, ito po ay full heat. Palms hotter than temples, empty heat. Palpation of hands and feet. So kasama na, ito naman po yung kamay at saka paa. So palpation of the hands and feet, particularly in regards to their temperature, it is important to diagnose condition of heat and cold. So malalaman din natin dito yung heat at saka cold. The most common cause of cold hands and cold feet is yang deficiency. Kulang po yung init ng katawan. Lung and heart, yung deficiency, will cause coldness of the hands only. So, tandaan po natin, pag ano po, ang malamig lang ay hands, so lung and heart po ang kulang ng init, yung deficient. Spleen and kidney yung deficiency will cause coldness. Particularly naman po, feet, but often of both hands as well. So pag involved na po yung spleen at saka kidney, ang lumalamig po ay ang feet at saka ang kanilang palms. So kasama din po yung stomach yang deficiency. So may cause coldness both of hands and feet. Yan. With the spleen and kidney yang deficiency, a particular feature is that not only the hands and feet, but also the entire limbs are cold. And women, cold hands and feet also may be caused of by blood deficiency. Yan. Kasi hindi na nga makasirculate ng maayos kaya malamig na po yung hands and feet. Pag heart blood deficiency may cause cold hands. Pag heart lang po, ang kulang ng dugo, yung kamay lang yung ang malamig. So, and liver blood deficiency may cause cold feet. Pag liver naman po, ang kulang ng blood, kulang ng naiimbak, ayan, feet naman po ang malamig. So, alam na natin differentiate, no? Pag kamay ay heart, pag paa, ang malamig lang ay liver, ang kulang ng dugo. Liver blood deficiency. Pwede rin ang stagnation of liver chi cause coldness of the hands and feet. Pag pareho na po siya, na malamig ang inyong paa at kamay, may stagnation na po yung liver chi. But particular the fingers and toes. O yun. Particularly na po yung inyong mga fingers. In this case, the cold feelings is not due to yang deficiency. Kundi mayroong chi stagnation. Hindi nakakadaloy ng maayos ang dugo. Stagnant. So being unable to reach the extremities. Kaya malamig po yung mga fingers. In cold hands and feet from liver chi stagnation, it is particularly the fingers and toes that are cold. So there are other less common causes of cold hand. May ibang dahilan at saka ng papo, ano. One is phlegm in the interior. Kung mayroong plema sa loob ng katawan, pwede po nitong i-obstruct ang circulation ng chi papunta sa ating limbs. Kaya lumalamig ang mga kamay. So this is also happen in the case of phlegm heat, giving rise to a contradictory hot and cold symptom. Another less common situation of cold hands and feet is when there is very pronounced and intense heat in the interior, obstructing the circulation of chi. Kapag mas sobra ng maraming init yung ating internal organ, yun po yung nangyayari, hindi na makadaloy ng maayos. So that it cannot warm the hands and feet. So will also give rise to hot and cold symptoms. An example of this situation is the condition of heat in the pericardium at the nutritive chi level within the 4 levels. which is characterized by symptoms and signs of intense heat. Pag tinignan po ninyo yung dila ay dark red without coating. Yung po yung sobrang init na, no? Dark red. Tapos meron po siyang lagnat sa gabi at mental restlessness. But cold hands, ito po yung summary natin, cold hands and feet. Ito may common causes. Pag kamay at paa ang malamig, ito po ay spleen or stomach yang deficiency. Pag kamay lang po, lung or heart yang deficiency. Pag paa lang, kidney yang deficiency. Cold hands ng paa ng babae, ng women ay blood deficiency. Cold hands in women, pag kamay naman, heart blood deficiency. Cold feet in women, liver blood deficiency. Cold fingers and toes, liver chi stagnation. So pag magpapalpate po tayo, siyempre sure lang na hindi naman sila galing pa lang sa aircon, kaya pinapahinga natin. Dapat normal yung maramdaman natin. Hindi sila galing sa labas na sobrang malamig. Pagpahingayin po muna ninyo. Cold hands and feet. Common causes. So, cold hands and feet is been, naulit na po natin pala. Ulitin po natin, common causes, cold hands and feet, spleen or stomach yung deficiency. Cold hands. Okay, nauulit natin. Next is palpation in comparison of dorsum and palm. And less common cause, cold hands. Okay, Doc, ano po? Palpation in comparison of dorsum and palm. When palpating the hands to feel their temperature, we should distinguish between the dorsum and the palm of the hand. Yung yung palad at saka yung likod ng palad, yung dorsum. A hot dorsum, yung likod po ng palad, so nagre-reflect po ito ng condition ng full heat. Whereas, yung palad po, nagre-reflect sa condition ng empty heat. Tandaan po natin, pag yung likod full, pag yung palad mismo harap, empty heat. And though, not exclusively so. Hot dorsum of the hand indicates full heat, and the hot palm usually indicates empty heat. Kapakapay natin ang mga palm. So in the context of exterior invasion of wind, palpation of the dorsum of the hands, yung likod po ng ating kamay, is important because it is confirmed the exterior nature of condition. In fact, in exterior invasion of wind, whether it is wind cold or wind heat, there is the characteristic contradiction between the patient's subjective sensation of cold, aversion to cold, or even shivering, yung nilalamig sila ng haliking, and the objective hot feeling of dorsum of the hand and palpation. The Chinese term fright, which is often translated as fever, in the context of exterior invasion of wind, actually refers precisely to this. That is the objective hot feeling of the dorsum of the hand and forehead on palpation. And the patient may or not have been an actual fever. So, pwedeng wala po siyang fever, pero mararamdaman mong may init siya. Nasa internal po niya. So, therefore, the comparison between the temperature of the dorsum and the palm of the hand has two interpretations. On the one hand, it helps distinguish full from empty. Balikan po natin. Pag dorsum, full. Pag harap ay empty. And on the other hand, in the context of acute disease. So it confirms the exterior nature. Chapter 74 of the spiritual axis relates the temperature of the palm of the hand to the condition of intestine. So yung palad po intestine yung ating tinitingnan organ. If the palm is hot, so nagsasabi po ito na may heat sa intestine. Kung lamig naman, nagsasabi na may cold ang ating intestine. Okay, palpate natin yung mga palm. Dapat normal. Wala naman akong lamig, walang init. Okay. Palpation of feet and hands in children. Sa mga bata naman, in children, condition of heat are normally reflected on the sole of the feet. Yan, kaya hinawakan natin yung paa ng mga bata. Which become hot, whereas condition of cold are normally reflected on the dorsum of the foot. O yung dorsum naman, yung ibabaw. On the leg. Which become cold. Also in children, yung mga dulo po ng kanilang fingers, pag malalamig, pwede pong sabihin na may shock siya or fright. If the middle section of the finger is hot, indicates the external invasion of wind. So, yun yung mga part ng nagsasabi po kung ano yung mga pumapasok sa katawan, lalo pa sa bata. Kaya pati yung nails, ipalpate natin yung mga kuko. Palpation of the hand should include pressing of nails. Yan. Didiinan din ninyo yung mga kuko. So, kung ang fingernails po ay is pressed at mayroong white discoloration appears and under normal condition, the nail should resume to its normal pinkies. Dapat pag diniinan nyo, di ba may puputi? Pero pag tinanggal nyo yung kamay nyo, dapat balik sa pinkies. So if the resumption of the normal pinkies colors occur slowly, pag mabagal yung pagbalik ng kulay, nagsasabi po ito ng blood deficiency or may blood stasis. Yan, sige, dinan po ninyo yung inyong mga kamay, ay mga fingers. Ay, yun. Pag mabagal blood deficiency. Dapat balik siya agad Ayan, no? So, yun po yung mga pagpalpate natin. Napakaganda po ng topic, So, thank you po for your attention. Dagdag kaalaman po ito sa ating pagdadiagnose.